Come in.
Hi, my name's Corrie and I'll be your student nurse today.
Okay.
I'm going to go ahead and wash my hands for 20 seconds according to CDC guidelines. Can you please verify your name and date of birth?
It's Harley Warren, 8/14/94.
Wonderful. And Harley, do you have any drug allergies?
No.
Okay. So Harley, again, my name is Corrie and today I've been tasked with doing a head-to-toe assessment on you.
Okay.
It's going to take about 15 minutes and it's literally me checking you from the top of your head to your tips of your toes.
Okay.
Are you okay if we go ahead and get started with that?
Yeah.
Great. I'm going to go ahead and put gloves on. And I'm going to ask you a few questions first.
Okay.
Can you go ahead and tell me where you are?
The hospital.
Okay. Can you tell me what you're doing here today?
I'm here to get a physical.
Okay. Can you tell me what month we're in?
August.
And can you tell me what day of the week it is?
It's a Tuesday.
Perfect. Patient is alert and oriented ×4. How are you feeling today, Harley?
I'm really excited. My birthday's coming up.
That is very exciting.
Yeah.
Patient's mood is appropriate to the situation. Harley, are you experiencing any pain today? Okay. If patient was experiencing any pain, I would have her rate it from 0 to 10. And then I would also use PQRST to have her explain the pain to me. Harley, do you feel safe here today?
Mm-hmm.
Do you feel safe at home?
Mm-hmm.
Okay. Well, I wanted to let you know that our medical assistant went ahead and let me know all of your vital signs, and it looks like you're within normal limits. She also let me know that your Snellen test, which is the vision test we took today, which tested cranial nerve 2, is intact, so your vision looks great.
Sweet.
So I'm going to go ahead and start with your head. So I'm going to go ahead and feel for any bumps, bruises, lesions, and edema. Any pain or tenderness?
Nope.
Perfect. Patient also has hair that is evenly distributed. Next, I'm going to go ahead and grab my pen light.
Okay.
I'm going to take a look at your ears. Ears are symmetrical. Any pain when I do this?
Mm-mm.
Okay, perfect. No drainage. I'm doing this on both sides. Any pain?
No.
Okay. Next, I'm going to go ahead and take my pen light. I'm going to shine it in your eyes.
Okay.
Perfect. Next, I'm going to go ahead and have you look at my pen light. Don't move your head.
Okay.
Just follow the pen light with your eyes. Perfect. Same thing. I'm going to go ahead and have you take a look. Perfect. Testing cranial nerves 3, 4, and 6 intact. I'm taking a look at your conjunctiva. It is nice and pink. Taking a look at sclera. It is nice and clear. Perla is pupils are equal, reactive to light, and patient is accommodating. So that looks great. Next thing I'm going to do is I'm going to take a look inside your nose. I'm going to go ahead and see here that there are no polyps. There's no drainage. Septum is midline, no deviation. Next, I'm going to have you open your mouth really big for me. Say, wiggle around. I'm going to go ahead and grab this right here. I'm going to go ahead and test your I'm going to test your gag reflex.
Okay.
Perfect. Go ahead and stick your tongue out. Wiggle it around. Go ahead and put your tongue back in. Go ahead and poke it out to each side. Go ahead and smile for me real big. Frown for me. Puff your cheeks out. I'm going to go ahead and put my hands right here. Close your eyes and try to open up. Perfect. I'm going to go ahead and take this little cotton pad. I'm going to go ahead and touch right here. Tell me when you feel something.
Touch. Touch. Touch.
Perfect. Patient's cranial nerve 7 is intact. Go ahead and open and close for me. Any pain? Okay.
Yeah.
Cranial nerve 5 is intact. I'm going to go ahead. We're going to do a smell test here.
Okay. What do I need to do?
Close one of your nostrils with the finger. Close your eyes. Tell me what smell this is.
Lavender.
Okay. And go ahead with the other side. Tell me what smell this is.
Peppermint.
Perfect. Okay. Cranial nerve 1 is intact. Okay. Next thing I'm going to go ahead and do is take a look at your carotid artery. I'm going to go ahead and touch here. And I'm going to go ahead and touch here. Then I'm going to go also and touch your carotid, and I'm going to go ahead and test your radial pulses. Perfect. +2. Wonderful. Next, I'm going to have you turn your head a little bit, or your neck for me a little bit, so I can test for JVD. Perfect. Other side. Go ahead and shrug your shoulders for me. Cranial nerve 11 is intact. I've also tested cranial nerve 9, 10, and 12, and they are intact as well. I'm going to have you turn for me just a little bit. I'm going to go right behind you. I'm going to go ahead and palpate your I'm going to go ahead and palpate your thyroid. Okay, thyroid is non-palpable. Go ahead and turn for me. Swallow. Taking a look at trachea. Trachea is midline. Next thing I'm going to go ahead and do is take a look at your lymph nodes. I'm going to palpate those. I don't want to feel them, okay? So first thing I'm doing is pre-auricular, post-auricular, occipital, retropharyngeal, submandibular, mental, and then I'm going to go ahead and take a look at your anterior cervical chain, your posterior cervical chain, and your supraclavicular. Perfect. Those are non-palpable. Okay, next thing I'm going to go ahead and do is take a look at your chest. So if you don't mind taking off your shirt from me, perfect. We're going to go ahead first. I'm going to go ahead and auscultate your carotid for any breweries. Okay. No breweries are present. Next thing that I am going to go ahead and do is I'm taking a look at your chest. I'm going to put my hands right here and have you breathe for me. Perfect. Respiratory rate is symmetrical. We are symmetrical.
Okay.
I am looking at your thoracic cavity. That is symmetrical. Next thing I'm going to go ahead and do is listen to your heart sounds, okay? I'm going to go ahead and start on your right side. This is going to be your aortic, starting at the second intercostal space of your right sternal border. Next, I'm going to go ahead and listen to your pulmonic, which is located at the left sternal border, second intercostal space. Next, I'm going to go ahead and listen to your to your Erb's point, which is located at the third intercostal space, left sternal border, I apologize. Next, I'm going to take a listen to your tricuspid, which is going to be your fourth intercostal space, left sternal border, and then your mitral, which is your fifth intercostal space, mid-clavicular. Go ahead and lean forward for me. I'm going to go ahead and listen to your apical pulse. I'm going to listen to your apical pulse for 1 minute. Perfect. Okay, next I'm going to go ahead and listen to your breath sounds. Every time you feel me move my stethoscope, go ahead and breathe in and out for me.
It's my bra, sorry. It's my bra, it's my bra.
Sorry. Perfect. And then I would be lifting here. Perfect. Perfect. Anterior breath signs are clear and equal bilaterally. I'm going to go ahead and have you stand up for me. I'm going to go ahead and listen to your posterior. Okay, again, every time you feel my stethoscope, go ahead and breathe for me. Perfect. I'm also going to go ahead and take a look at your posterior. I'm noticing that there's no bumps, bruises, no lesions, skin is warm. Go ahead and take a breath for me. Perfect. Okay, if you want to go ahead and I'm going to have you turn around for me one more time. And I'm going to have you turn this way and go ahead and walk for me. I'm going to go ahead and look at your gait. Okay, go ahead and walk back for me. Okay, I'm going to have you face the wall. I'm going to have you put your right hand over your right ear. I'm going to go ahead and say 3 things. Go ahead and tell me what they are. Red, green, monkey. Red, green, monkey. Okay, left hand over your left ear. Purple mouse kebab. Purple mouse kebab. Perfect. Okay, thank you so much for doing that for me. Go ahead and sit back down. Okay. Next thing that I am going to go ahead and do is I am going to go ahead and take a look at your upper extremities. Okay. I am looking for any bruises, lesions, bleeding. There are none. Skin is nice and warm. Perfect. Okay, go ahead and turn your arms for me. I'm going to go ahead and feel for your radial pulses. Perfect. I'm going to go ahead and feel for your brachial pulses. +2 bilaterally. Perfect. Next, I'm going to go ahead and do your deep tendon reflexes. First thing I'm going to do is your brachioradialis, Perfect. Next thing I'm going to go ahead and do is your bicep. Perfect. And then I'm going to go ahead and test for your tricep. Perfect. I've done that bilaterally. Patient's deep tendon reflexes are all within normal limits. Okay. Next thing I'm going to go ahead and do is check cap refill on all fingers. I'm checking them bilaterally, and then we are all less than 2 seconds. I'm going to go ahead and check for skin turds. Little pinch, it shouldn't hurt. Perfect, no tenting. Okay, Harley, if you don't mind laying down for me. Next, I'm going to go ahead and do an abdominal assessment. First thing that I'm doing is taking a look at the skin. No bumps, bruises, lesions. Stomach is flat. I'm going to go ahead and auscultate here for your abdomen. We're going to go ahead and listen for your bowel sounds. I'm going to listen to each quadrant of the abdomen for 1 minute, starting with the lower right quadrant. Perfect. Bowel sounds are normal, active. I'm going to go ahead and lightly percuss here. Any pain or tenderness? No. Okay. I'm going to go ahead and palpate here. Any pain or tenderness? No. Okay, perfect. Now, if I did not hear any bowel sounds, I would go ahead and listen to each quadrant for 5 minutes. Okay. Let's see here. Can you tell me the last time you went to the bathroom?
30 minutes ago.
Okay. What color was it?
Clear.
Any odor?
No.
Okay. What about a bowel movement?
Yesterday.
Okay. Was it normal for you?
Yes.
Okay, perfect. So next thing I'm going to go ahead and do is I'm going to take a look at the lower extremities. I am feeling for warmth. The skin temperature is warm. There's no edema, no scarring, bruises, or bleeding. I am going to go ahead and have you take this this heel right here and go ahead and rake it across. Perfect. I'm testing your lower motor neurons. Go ahead and do the same with this one. Perfect. Next thing I'm going to go ahead and have you do is push against me.
Okay.
Okay.
I don't know if they can see it. Here, come down.
Oh. I'm going to have you push against me. Perfect. Go ahead and push against me again. Lift one leg up for me. Lift the other leg up for me. Wonderful. Range of motion is within normal limits. I'm going to go ahead and do capillary refill on all toes. Perfect. Less than 2 seconds. Go ahead and sit up for me. And then before, I'm going to go ahead and do your pedal pulses. Perfect. And then I'm going to do your posterior tibialis. Okay, wonderful. Okay, go ahead and sit on that for me. Next, I'm going to go ahead and check your patellar reflexes. Perfect. Perfect. Okay, go ahead and do Romberg. So I'll do the Romberg in just a second. First thing I'm going to have you do is push your elbows, go ahead and push against me. Okay, perfect. Go ahead and do the same thing. Resist me. Go ahead and squeeze my fingers just as hard as you can. Perfect. Patient's grip strength is within normal limits. Range of motion is within normal limits. Go ahead and lift your arms up and down for me. Perfect. Go ahead and stand up for me one more time. Close your eyes for me. Put your hands down, and patient has a negative Romberg test. Go ahead and sit back down for me one more time. Last thing I'm going to go ahead and do is test your upper motor neurons, and I'm going to have you flip, flop, flip, flop, flip, flop for me. Perfect. Okay, Harley, I believe that we've got everything done. I appreciate your time today.
Thank you.
Have a great birthday.
Thank you.